Hello, everyone. Welcome to today's Permanente Docs Chat. I am your host, Alex McDonald. As many of you know, I practice family and sports medicine here in Fontana, California, as part of the Southern California Permanente Medical Group. And today we are chatting with Dr. Stella Dantas of Northwest Permanente Medical Group, who, amongst many other things, was recently elected as president of the American College of Obstetrics and Gynecology. So welcome, Dr. Dantas. I'm so excited to have you here.
Thank you. Thanks for inviting me.
We are going to be going a lot of topics today, from leadership and burnout and culture of medicine. And so if you're joining us live, please get your questions into the Q&A box early and often. We're going to keep this short and high yield. So we're going to jump right in. So Dr. Dantas, tell us in your own words, tell us who you are and what you do.
Well, I'm an OBGYN here in the Northwest. As you said, I work for Northwest Permanente here in Portland, Oregon. I've been an OBGYN here for 23 years this summer. And I practice full scope. I'm also the director of graduate and undergraduate medical education here at Northwest Permanente. And as you said, I just was inaugurated on May 19th as the president of the American College of Obstetricians and Gynecologists.
Amazing. Congratulations on your election. That's such an accomplishment and speaks to your leadership and all the work you've done.
Thank you.
So tell us a little bit more about ACOG and your term as president. Sort of what motivated you to run for this position, and what are your main goals for your term as president?
Well, I've been involved in ACOG ever since I was a resident. So we're going back now 25, 27 years. And, the motivation for me, I never had a thought that I was going to be president of ACOG. In fact, I saw a text stream someone sent to me from 4 years ago before the pandemic where someone said, "Oh, you'll be president." I'm like, "Yeah, I'm not doing that." And they said that to me after my inauguration. It was about helping people. So as a resident, it was about, we'd get together, talk about how to make, residency life better, improve that culture. Then it was about helping my colleagues in Oregon, making births safer in Oregon without a hospital birth. It was always about a mission of helping and service. And now it's a critical time. It's wanting to support our members, support my colleagues, support the obstetricians and gynecologists, which are the workforce, and how we are going to take care of the population. So it was really an organic thing. It wasn't something I thought I had a plan for. And really what I talk about, it's really people helped me to see that is where I could be of service.
Mm-hmm. Yeah. Well, and that's key, is it's really about servant leadership. And I think that's really the most amazing thing. And a lot of different organized medicine houses, wherever you may be, it's about how can I help my colleagues? How can I help my patients? How can I be of service, as opposed to it being sort of all about you as the physician. We are, again, a part of a ginormous team. Ginormous, that's not a real word. I apologize.
And then you asked about my focus. So my focus,
yeah, please,
is about community connection and belonging. And so in my speech, I talk about how, we have a lot of issues, especially in women's health, but in medicine in general, right?
Mm-hmm.
That are burning out our physicians, burning out our workforce, and we have to take care of them. And I can't solve reimbursement issues tomorrow, and I can't solve legislative interference or all the administrative burdens tomorrow. We are working on that. We are always working on that. But what I can do is provide the community, the culture, the team to help us stick together and get through that. Yeah. So that is my focus is on community, connection, and belonging.
Wonderful. I love it. It's great tweetable or postable phrase. So I like that. Well, and tell us how your experience within physician leadership in Permanente, how that has helped you grow, and what maybe how Permanente has supported your leadership role to be ready for now a national leadership role.
Yeah, well, I'm thankful to Permanente because, again, I was thrown into roles I never applied for that I got asked to do.
Voluntold.
Little did I know that it was creating a path for me to do something like this. So first, I think Permanente medicine prepares you for working in a highly integrated model where the patient is in the center.
Mm-hmm.
work on the quadruple aim, and that and working on the care experience and along with quality and controlling the cost of healthcare and also protecting our physicians and our clinicians so that they don't burn out, right? That's all part of it, but you keep that patient in the center. That is driven into us as Permanente physicians and as leaders. And so the
Mm-hmm.
meeting and how you communicate that. And so in all my leadership roles, it was, we do hard stuff as leaders, right? It's not easy being in healthcare today. And I think what really helped prepare me is some of the challenging times I had to lead through, the start of the COVID surge, consolidation of buildings, different things that I've had to do where
Mm-hmm.
communication was key, because sometimes we're not all on the same page, but if you can understand the why and you can communicate out the why effectively, we can all wrap our minds around the same thing and be rowing in the same direction.
Yeah, communication is such an important piece, and over communicating, especially in leadership. I think also, physician leadership is so important when it comes to, the healthcare team, right? Because we know medicine is a team sport, and really having physician leadership is so important when it comes to quality and safety, and really kind of keeping the patient at the center. So what are some of the skills and competencies that you think physicians leaders really need to sort of develop, and how can they acquire them?
Well, well, I think we have to be all things to all people, and I say that
Right.
jokingly, but I never saw myself as a leader. I'm not your typical. I've walked into rooms where people were like shaking my husband's hand because they thought he was the president or the person in the room, and then I get up to the stage and surprise people. So I think for leaders, you have to be flexible in your leadership style,
Mm-hmm.
right? You need to be a little bit of a driver. You need to be a little of an amiable. You need to be a little of an analytic. So you have to have kind of diverse portfolio of skill set. So it's not about one type. It's also about being able to listen, to being able to be vulnerable, and to being able to relate to people so that you can get people on board. So you have to be able to build relationships, build connections, again, to have the hard conversations. I think it's critical in creating psychological safety, because
Mm-hmm.
as a leader, you don't have to know everything. You just have to get the right people around you to express and to build the right product or drive together to the right vision.
Yeah. So again, it's all about the team, is what I'm hearing you say. Is that right?
Yep, you got to build that team, and they have to be able to communicate with each other and work together. You have
Yeah.
to give them the autonomy too to be able to get out of their way and have them work to their skill set.
So tell me more about sort of how you go about creating that culture, because we know culture within, a clinic or a hospital or a medical group or a health system, is such an important piece of the puzzle. So how do you build that culture that you want? Is it from the bottom up? Is it from the top down? Is it somewhere in the middle?
Well, I think about the West Side Hospital where I work. We opened up this hospital in 2013 here where I am, and we had the luxury of building the culture from the ground up.
Mm-hmm.
So
Yep.
when you can do that, that's special, right? But in order to build a team, you have to really be invested in taking the time to get to know your team,
Mm-hmm.
and get everybody on board with a shared vision, create a culture where you make people feel like they belong, where they feel like they can speak up and that you trust them. So it's about building trust, about building connection, about understanding where people's real skills are, and then giving them something to do that has them rise to that, recognizing what their gifts are. I think when you really see people and you spend the time to do that, you have to spend time together. I think the
Mm-hmm.
pandemic was really challenging because we were so
Yep.
siloed. So it's about breaking down those silos, putting energy into people, and building those relationships.
Yeah, no, I that culture and those relationships are so important. And this kind of dovetails into my next question, and actually a question in the chat actually came in, which is along the same lines. So I'll kind of mush them all into one. So I apologize if this is not the most eloquent in the world. So we know that culture and particularly community is so important when it comes to creating a physically and psychologically safe environment, and also combating, burnout and a lot of the challenges that really are weighing on physicians over time. So again, how does that community building really play into it? And then the question in the chat here is regarding collegiality, and building those relationships to help improve the communication and really ultimately improve the patient care. So I'll let you riff on that a little bit. That was a lot to throw at you all at once.
Yeah. So building community helps with leadership because one, leadership is lonely. And
Mm-hmm.
so when you are a leader and you're leading something, you need having community around you, having people support you, having people to understand when you are trying to drive something, and for them to feel safe and saying, this is what we don't understand. This
Mm-hmm.
is what we think you're not seeing, right? Like that is you need to be able to create that space for people to be able to do that. Because if
Mm-hmm.
you don't, if you and the collegiality piece goes along with that. So if I'm in a room and I'm leading a meeting and I see people who are quiet, I'm going to create space and ask them, what are
Mm-hmm.
their thoughts? And I started off my first board meeting saying that, I need to hear from everybody in the room, and I'm creating my goal is to create that space. And if I ever do something where you feel like I'm cutting you off or I haven't, I want you to let me know that because I need to grow. I'm not a perfect leader. So I think all of us being humble and showing humility that it's
Mm-hmm.
going to take all of us in the room to do something. That is the community I'm talking about.
Yeah, no, and I think all the pieces that talk about, physician burnout and leaving medicine in general, all those sort of strategies, they have that common theme of community and sense of belonging. And I think I'm biased, obviously, but I think, being a part of my professional society is a really, really big piece of that. And also being a part of Permanente medicine is a big piece of that for me personally. I don't want to speak for everyone out there.
Yeah, when you feel that sense of belonging, there's also that affinity that is created with your organization, right? Or your group, or, so it creates that family unit, for lack of a better term.
Mhm.
When you feel that, oh, they see me, they're there for me, you want to be there for each other. So again, and then on a larger scale, if an organization understands all the pieces to support well-being,
Mhm.
actually putting energy toward that. They're actually listening. Not that they can do it all, right? We have a budget. We
Right.
can't do everything, but that they're listening and they're understanding and they're speaking to it. And they are, they're putting energies towards something. Again, they can't do everything. That creates affinity again. And then you even with hard stuff, people stay, right? And
Mhm.
that's what we need. We need, in my workforce, we need people to say we have an aging population, people are retiring early. I'm trying to create a sense where people want to stay in the workforce. They want to stay working together.
Mhm. Yeah. What I mean, is there anything specifically that ACOG is doing or other initiatives that you think? I mean, you mentioned a lot of this already, but what kind of other sort of mitigation or prevention strategies can we do to help prevent physicians from cutting back to part time or quitting altogether? Is there anything specific you want to do, or you think that we might need to work collectively to do better?
Well, I think it's work that we are all doing. It's evergreen work. So
Hmm.
one of the largest things, right, is the administrative burdens. People go into medicine thinking I'm taking care of patients, and then
Right.
all of the administrative work that gets piled on that is not there's no time in the day to do it because we are always going to tend to the patient. That's our calling. And
Right.
so how do we figure out the right support? Working collaboratively, working in teams. ACOG's doing that. We do that great here at Permanente, working in multidisciplinary teams where everyone's working top of scope together to take care of the population. So it's about doing that work. And of course, there's advocacy work to do with legislative interference, especially
Hmm.
in my field. And people think maybe it's only my field, but it's everywhere. Like in order to practice evidence-based medicine, we are the ones trained to do it.
Right.
We have to have that autonomy to do it, and whether it's in a gynecological care or something else, it's a creep, right? Politicians are not trained in medicine. So it's doing all of that work. And then the last thing I want to mention is misinformation, because I think
Mhm.
that one of the biggest things, and you can probably relate to this, Dr. McDonald, is when you're in a room. For me, I'll give an example. A pap smear. Pap smears are now every 3 to 5 years, but you take the time to explain that to a patient. You don't have the time built in, and then
Mhm.
sometimes it creates distrust, right? So getting good information out there to our patients and the public is something ACOG's doing. I know Permanente does that. So it's something we can all do together.
Yeah, no, misinformation is definitely a topic which I am very passionate about. I'll try not to get go off the rails, I promise. One thing that I always like telling patients is, look, you are in charge of your body. You get to make the ultimate decisions. My job as a physician is to help you understand the landscape and make recommendations, but ultimately you're in charge. And if you're making those decisions based on bad information, that's our onus as physicians to help give you a source of good, trusted information so you can make the best decisions for your own body and your own healthcare. And so that's the way that I frame it. And I feel like I have that conversation every single day. Even though it feels like politics kind of comes in the play, if you can kind of center it on the patient, and that's what really works well for me personally when I'm communicating with patients every day.
No, it's about shared decision making, but we're not supported out there in, and I don't have TikTok, but I know there's a lot of TikTok going on about stuff in my field, right?
Sure.
And that is what I mean. Like when that social media is out there putting out misinformation, sometimes when you're doing that work, do they trust their friends? Do they trust social
Mm-hmm.
media? Do they trust you? And so you're
Mm-hmm.
having to give them information and build that trust, and that takes time, right?
Yep.
And so that's where I worry about sometimes we're burning out people. And so whatever we can do to support that, get out in front, get our own stuff on social media, on TikTok, that draws people into the right information.
Yep, yep. There's a see prior podcast regarding social media and misinformation, so we don't have to reinvent the wheel here. No, I'm just teasing. Um, we could probably go on and on about that topic alone. Let's switch gears a little bit here. So you've been involved in several initiatives to really promote diversity, equity, and inclusion in medicine, and particularly women in medicine and leadership. In addition to unrepresented minorities in healthcare. So why are these issues important to you, and what are some of the benefits and challenges of really advancing them within the healthcare profession?
Well, I think we all know that it's one thing to create access for patients.
Mm-hmm.
And then it's another thing to get our patients, they're in your exam room, to listen to us, to your point, right? To really listen to us. We're putting out the menu of options, and for them to trust us, and then choose what they want to do, right? It's ultimately their choice. And we know that there's evidence that when people can relate to people's backgrounds, they're more apt to listen, they're more apt to come in and get care and
Mm-hmm.
follow through on that care. And that is how we're going to increase the care, the health of the population. And so in that sense, of course, we need to improve on the diversity of our workforce so that we have people, all patients, our diverse population can relate to. And then in terms of leadership, you know, um, there were many times in my growing up that I was told I couldn't do things because of
Mm-hmm.
my skin. So, I have that lens. And then as I went forward, it was interesting being a female leader. I think I'm one of the younger presidents of the college. And it's because what was motivating me at one point was um, younger leaders who may look like me and females were like, how are you doing that? You
Mm-hmm.
have young kids. And I'm like, because I bring them and I put them, I figured out how to do it, and it wasn't easy. But I think when they are able to watch somebody that's like them navigate that world, then they feel like they can do it. So I think it's really important for us to have people that we see ourselves
Yep.
in different positions, because it
Yep.
inspires people, and then they feel that they can do it too.
Yeah, no, and I think again, I am a white male. I'm not a minority in medicine whatsoever, but I think also, my wife is a female physician. She's a leader in our area, and I often will go to our local women in medicine conference. And I remember the first time I went, this I was sitting at a table, and one of the people looked at me and they're like, what are you doing here? And I'm like, so I can learn to be a better ally, right? And so I think a lot of the issue is women in medicine, women in leadership, DEI. It's not just about someone else. It's not just about a woman issue. It's not just about a BIPOC issue. It's about all of us, and all of us in medicine, regardless of our ethnicity or background, need to sort of take a leadership role and step up and educate ourselves about those issues so we can be better allies and we can better support our colleagues.
Well, I mean, in my speech last week, I mean, that is what I recognize. My allies up there, you get to have escorts, right? Two of them are white men, right?
Mm-hmm.
Those are the people that encouraged me and saw in myself something I did not see.
Mm-hmm.
And I'll just say one other thing that was inspirational for me. I have the privilege of going around the world to represent ACOG, and I went to Taiwan last March, and I told you how people were looking at my husband, they kept shaking his hand, and he's like, "Do you know these people?" I'm like, "No." And then I got up to give the presidential address, and afterwards, the number of young physicians that came up because they had never seen someone that looked like me in a position like that, and just the light bulb that went off for them,
Yep.
I was like, okay, that's worth it right there.
Yep. Hashtag representation matters, right?
Yeah. Yes.
Amazing. Okay, we can go on and on. We'll try to keep this short. Last question. I always end with this one. This is my favorite one. What makes you most proud to be a Permanente physician?
Well, from when I was well, I grew up in Permanente. My mom is a Permanente physician, and
Okay.
so I seeing what she went through as an early Permanente physician to where I feel like we are now, where we are the model that is, if we can replicate that, we can help solve healthcare issues in this country. Makes me really proud. I came here because I really wanted to take care of patients and practice evidence-based medicine. And yes, administrative work worked its way into my fold at some point, but really we are here for the patient's in the center. And I think that is our calling. And I feel we get to practice our calling here at Perm.
That's wonderful. Perfectly said. So thank you so much for joining us. Congratulations again on your presidency. I'm excited to watch you and all the amazing things you will do. And your time and your insights are really, really valuable. So thank you so much.
Thank you. Thanks for the opportunity to be here.